Are you aware there's even another reason why plantar fascia doesn't resolve that a lot of people have no clue about? Well, you might want to watch this one too. So this is part 3 of a little series I'm doing on plantar fascia and why plantar fasciitis often doesn't resolve or takes forever for people. 6 months, a year, and some people it just keeps coming back. It recurs, right? And you've tried everything. You've tried everything that everybody recommends. You go on the website and there's millions and millions of different sites and suggestions and resources that you're just, it's like a tsunami of information. So how do you figure it all out? And then you try everything, maybe even go to some experts, some professionals, and what they recommend, they even say, well, you can try this, you can try that, maybe you even went to some of those real expensive orthotics and they're not really helping. Or you might be watching this because your plantar fasciitis has been resolved and you're kind of curious, but you've got those expensive orthotics and they made a beautiful difference and they helped you miraculously with your pain. But now, 6 months later, a year later, 3 weeks later, you got some other issue going on. You got a knee that's not happy. You got a hip that's complaining. Maybe your low back, maybe a shoulder, maybe your neck. And so you haven't put that together with the fact that that orthotic device could have altered the body mechanics to the point where, sure, it got rid of the plantar fascia pain, but it's got something else that's not real happy about what's going on because of that orthotic. And it's now starting to complain and beg for help. And you don't put the two together. So it's really important that you understand the major facets behind the mechanics of the body so that your plantar fascia is a happy structure and not being asked to do more than it's designed to do and not getting irritated, inflamed, annoyed with every step you take. So, we've done a couple of videos on this. This one I want to talk about something that people have no clue about, and it's that side-to-side motion. Now, in the hips, it's called ABduction if it moves away from the body, and it's called ADduction if it moves in toward the body, right? So AB and ADduction. You really need that so that everything is being triggered properly, so that that whole thing about the heel, which was part 1 of this, everting, inverting, what happens when your heel everts all has to happen correctly at the right time, the right way, so that what happens above happens the right time, the right way, so that your heel will invert. And that's when your plantar fascia is happy, because the foot's doing what it's supposed to be doing, and the plantar fascia doesn't have to do 4 people's job trying to stabilize your foot and getting really overworked because of it. So, and it's funny because when you look at the websites and you look at all of the major, even the major medical websites, a lot of the times when they put causes, they'll say overuse. Well, unless we want to walk on our hands, we kind of have to use our feet, right? And if you've got any kind of a job that requires you to stand, you got to use your feet. Even if you've got a sit-down job, you got to get from your car to your desk. Even if you're home, you're not going to be floating around in the air. You got to be able to walk on your feet, right? You got to use them. So the overuse thing, not really a big fan of that being a really accurate cause, because our feet are designed to be used. Our feet are designed to serve our body from the ground up. But if the foot isn't working right, nothing above's going to work right, and then it's not going to get triggered to work right and go down and kind of trigger back down and cause the foot to do what it needs to do in that phase where you've got a nice solid foot so that you can push off in gait. The first phase is where you're landing on your heel and everything's triggered so that you have a nice soft, flexible, shock-absorbing foot. But before you go to do toe off, that foot has to completely transition so that it's providing a solid, bony surface for you to push off. And if it doesn't do that, that's when the plantar fascia is not a happy camper. So, part of all of that happening requires good frontal plane motion, or ABduction of the hips. So how is yours? Just kind of stand there and test it. Just do a little side to side. Watch yourself in the mirror. Are you going as far to one side as you are to the other side? Try it in different foot positions. So right now, my feet are just hip width apart, right under me. And I'm going to go right, and I'm going to go left. And I'm kind of feeling like I'm not going quite as left as I go right. So there's a little bit of a difference, right? And then try it with your feet out wider. So now you're going to get a little more abduction when you go this way. And you're not going to be able to go quite as far because your feet are out, right? But notice, do you have any pain? Is anything feeling abnormal? Feel what happens at the foot when you do that, right? Try it when your feet are narrow, like right next to each other, right? What's happening with those hips? Now, try it with just one foot. So I'm going to keep that foot right under me. I'm going to make that one kind of go out wide and just toe tap. And let's see what happens when I go that way. Just kind of test your hips and see what happens. All right? Now, if you notice there's a big difference between sides, one side really isn't doing all that great compared to the other side, we can work on maybe getting it a little better by changing the foot position, right? So, say for instance, say it doesn't feel as loose me going this direction. So what I can do is I can change my foot position. So I can try putting my left foot forward a little bit and kind of working that. Does that feel like that made it a little bit easier? Maybe, not quite sure. I can try bringing it back here. And now that, I do feel like that made that a lot easier. So with that foot back, I can go further. So now I would work it there for a little bit, right? I can even add some arm motion to really get a little bit more going on that side. Okay? Now that's ADduction that we're working on here. And now let's come back to where we started. And let's see, did that make any difference? I'm going to go that way. I'm going to go that way, and wow, yeah, they feel pretty much the same now. I'm not feeling like that side feels a little stuck. Just that little bit. Now, of course, I do this all the time, and I don't have any problems that I'm aware of. No limitations. I'm always showing and teaching things. So sometimes, you know, you may not be what I'm showing. You may see a big difference between sides, and you want to get that back. That could be why the plantar fascia is not happy. Now make sure you watched parts 1 and part 2 because I talked about the heels, I talked about rotation, and now we're talking about the side motion, okay? It's really important that you have these motions or your feet, your foot, ankle, calf complex is probably not functioning optimally. And if that's the case, you could have pain anywhere. We're not even talking just plantar fasciitis. You could have neck pain, shoulder pain, rib pain, low back pain, hip pain, knee pain. You can have pain anywhere if that's not working right. If you're not getting the eversion, the inversion, you're not getting that beautiful full rotation, and you're not getting ADduction. And of course, we want ABduction, which is when the leg moves away. Only so much I can teach in these short videos, right? But hopefully you're getting the idea. It's a lot more than just rolling your foot on a frozen tennis ball can, right? It's a lot more than going and getting a steroid injection. That might decrease the inflammation if there's even inflammation there. Check out my Friday value videos. I did a whole series of those. And, well, they may not all be out by the time you see this, depending on when you see this. But a lot of the treatments are stopgap at best, Band-Aid at best, and they're not addressing the reason the problem's there. If it's because that heel bone's not everting, inverting, all the medication in the world, all the procedures in the world, all the treatments in the world are not going to restore that. You have to train your body to restore that, right? Or you've got to find somebody skilled to help you restore that. So, hope this helps. Please subscribe if you're not a subscriber. Hit the like button if you liked this so others will find it. And stay tuned for the next part where I'm going to talk about another reason plantar fasciitis doesn't resolve that you might just benefit from knowing. All right, see you next time.